Welcome to the fourth and final meeting of the Legislative Committee on Senior Citizens, Veterans, and Adults with Special Needs for the 2021-22 Legislative Interim. For members attending virtually, would you please turn on your camera and respond when you hear your name? Madam Secretary, please call the roll.
Senator Buck?
Here.
Senator Scheibel? Senator Spearman?
Here.
Assemblywoman Considine?
Here.
Assemblyman MacArthur? Chair Gorlow?
And here. Thank you, Madam Secretary. And please indicate Senator Scheibel and Assemblyman MacArthur are excused. Some housekeeping items. Before we begin, I would like to take a moment to go over some basic housekeeping items. First, please silence all your electronic devices, especially cell phones and laptops, during the meeting. Let me silence mine. There we go. For those that are joining on Zoom, please be sure to mute your microphone when you are not speaking to minimize the background noise. For individuals on Zoom, the chat feature is only to be used for technical assistance with BPS. It is not to be used for any communication between members or the presenters unless requested technical assistance from BPS. If you wish to testify in person, please sign in at the table by the door and leave a business card. If you do not wish to testify, you may also want to sign in so there's a record of who is interested in a particular topic, and in the event the subcommittee needs to contact you later. As a reminder, meeting materials can be accessed on the committee's webpage. Anyone who would like to receive electronic notification of and access to the committee's agendas, minutes, and final report can do so by signing up on the Nevada Legislature's website, and that is leg.statestate.nv.us. And with that, we're going to get started. There'll be a public comment period at the beginning and at the end of the meeting, and public comment is limited to 3 minutes per speaker. In addition to testifying in person, members of the public may provide public comment in 4 different ways, all of which are listed on the agenda. Witnesses who wish to provide members with additional information or have their complete testimony or handouts included in the permanent record should provide a paper or electronic copy to the secretary. You can find the contact information on the committee's webpage. Members, there is public comment that was emailed to the committee, which is available on the committee's meeting page. And Madam Secretary, please ensure that these comments are included in the record of the meeting. With that, we will move on to public comment, and we will start with those in the physical location and then move on to anyone who has called in. When testifying, please remember to turn on your microphone and clearly state your name and the entity you represent at the beginning of your testimony. Is there anyone in Carson City who would like to provide public comment at this time? I don't see anyone going to the table. So is there anyone in Las Vegas who would like to provide public comment at this time? Please come forward.
Do you want me to say my name? Yes. Okay, my name is Michelle Rose, and I'm a parent of a child with a disability. Okay, proceed? Okay, good morning, Madam Chair, members of the committee. For the record, my name is Michelle Rose. Thank you for the opportunity to share my family story and what I believe has become an emergency in the state of Nevada. The issue I will be speaking about is Medicaid home and community-based provider rates. I come before you as a parent of a severely handicapped 33-year-old adult that has a caregiver. I struggle to keep her as my son's caregiver because her wages are so low. Medicaid provider rates in the state of Nevada are currently insufficient to cover the hourly wages for direct support professionals or professional care attendants. This state has gone backwards. Caregivers are receiving between $11.75 and $13 per hour of the $17.56 reimbursement rate. After the pandemic, wages were raised exponentially across the state to $15 to $17 per hour, in jobs that do not require care for people with disabilities. As an example, Starbucks pays $16 an hour, Target pays $15 an hour, and there are many more. Providers like Opportunity Village, Easter Seals, Capability Health, and the many private companies that provide in-home services cannot recruit qualified, reliable people to employ without a state Medicaid rate increase. At current wages, who can compete with the retail sector or other industries? This puts our most valuable people in society at risk. Without providers, families cannot go to work. We must provide care for our loved ones at home. This further exacerbates the support system. This has become a systemic issue across the state. There are hundreds of families with loved ones sitting at home, not being able to get into a program because provider organizations cannot hire the support staff that is needed. The waiting list for services grows regularly. One parent or family member has not gone back to work because their parent must stay at home with their child. I try very hard to keep my son in my home. This is beneficial for him and the state since the residential housing cost is 3 times more money than providing caregivers in my home. With the provider rate as low as it is, it's becoming increasingly difficult. If I fail at caring for my son, it will cost the state more money. Please help me and other families like mine. Please find a way to increase Medicaid provider rates to make sure our family members can get the services that they need. Thank you for considering this very important issue that I have brought before you today.
Thank you very much for being here and sharing your family's story. And just out of curiosity, for the record, do you spell your name with 1 L or 2?
2.
The right way. Yeah. Thank you again for being here.
So much.
Is there anyone else in Las Vegas who would like to please come forward? And you can sit at either seat. Please push the button right up front. There you go. Thank you.
You're welcome. My name is Tracy Richards, TraceYRichards, Richards. I am a home care worker of Nevada, and I've been a home care worker for over 16 years. I have to say I agree a lot with the young lady that just came up here. I thank her. She keyed in on a lot of points here that we're dealing with out here. I would like to represent over 13,000 caregivers out here in Nevada, period. And it is a struggle, the hardships that I go through day to day being a caregiver, from the gas, from the groceries to utilities. The inflation has really been an issue. The wages has not been increased, and they need to be increased. But in order for that to happen, again, like the young lady spoke before, that Medicaid needs to be increased as well. You know, we have to, everyone at this table, everyone in this room is going to end up with we're needed, we're essential. You know, everyone in this room is going to have a person in their family that needs one of us. We're essential. We're needed out here. This is necessary, as well as that second $500 round payment that hasn't came up either. You know, it doesn't make any sense. And I'm here to represent the caregivers in Nevada. I've been a caregiver for 15, 16 years out here. We are essential. We are needed, as well as the increases. It's needed. I struggle with gas. I struggle with bills. I struggle with groceries. It's real, and it's rough. So I just want to get up here and speak on behalf of that, and to speak as far as the increases, as far as, you know, we're needed out here. You know, families need us. So I thank you, and you guys have a good day. Thank you for listening to me today.
Thank you very much for being here, Ms. Richard. Appreciate you sharing with us your story. Is there anyone else who would like to come up from Las Vegas? Seeing none, is there anyone on the phone who would like to comment for public comment?
Thank you, Chair. To provide public comment, please press *9 on your phone now to take your place in the queue. Caller, you're unmuted. Please proceed.
Good morning, Chair Gorlow and committee members. I'm Lisa Foster, and I represent SNAP, the State of Nevada Association of Providers. Licensed by the Aging and Disability Services Division and funded by Medicaid, SNAP members provide residential services, also known as supported living arrangements, and jobs and day training services to adults with intellectual disabilities throughout the state. You've heard a parent testify about their frustration with maintaining consistent services for their adult child. These parents cannot count on maintaining employment themselves due to the uncertainty of whether their child will be able to receive services from day to day. This, of course, is due to the provider's inability to maintain a stable workforce. SNAP tracks the turnover rate quarterly among these providers, and that rate is currently at 140% on an annualized basis. The state has used Arpa funds to increase wages through 2022, but this increase only allows providers to offer a starting wage of just over $13 an hour. Fast food has always been SNAP's biggest competitor, with starting wages listed at $15 an hour on In-N-Out's website yesterday. These skills required for that job and those needed to care for an intellectually disabled person do not compare. We're asking the legislature to approve a budget that will pay a wage that stabilizes the workforce that cares for these Nevadans. The wages need to not be behind the fast food industry or even a hair in front of it. They need to be wages that will attract caring, consistent workers who will strive to assure all Nevadans, especially the thousands with intellectual and developmental disabilities, receive the support they need and deserve. Thank you for your time.
Thank you very much for your comments. BPS, next caller, please.
Thank you, Chair. Once again, to provide public comment, please press *9 on your phone now to take your place in the queue. Caller, you're unmuted. Please proceed.
Good, happy Tuesday morning, Madam Chair and the rest of the committee. My name is Dora Martinez, and I do represent the Nevada Disability Peer Action Coalition. I'm sorry, can you all hear me? I have a headset. I don't know if I'm too far or close.
We can hear you in Las Vegas.
Okay, thank you. Thank you so much. So I do want to bring to your attention the slogan "Without us," about us without us. Please consider that as you make recommendations to the personal care attendants. My son does work, and he makes more than what these important people are doing. Taking care of the disabled community. He makes $20, and I wish we would hire these folks at $25 an hour, just enough to pay rent and all the expenses that's gone up. So please keep that in mind. We are the disabled community, and I've always said this, are always first to be forgotten and last to be considered. So I know that Nevada is well known for including people with disability. I mean, we started with the Right to Parents Act 2019, sponsored by Assemblywoman Cohen, and everybody voted for it. Thank you for that. And last year, the AB 121, people with disability and underlying health issues are able to vote comfortably at home with this awesome accessible voting platform that's secured. So please keep that in mind, and let's make it Nevada home. Home means Nevada. Thank you so much, and have a great morning. Take care.
Thank you so much for calling in. It's always a pleasure to hear your voice. Hey, BPS,
Chair,
do
there
we
are
have
no
another
additional
call?
public. Oh, I'm so sorry. I apologize for interrupting. I just wanted to let you know that the public line is open and working, and there are no additional callers at this time.
Well, thank you very much. Seeing there are no more calls, we'll move on to our first order of business. Agenda item number 3, approval of the minutes for the meeting held on June 28th. All members had access to the draft minutes, which are posted on the committee's webpage, along with other documents for this meeting. Committee members, are there any questions regarding the minutes from the previous meeting? Okay, seeing none, I will entertain a motion to approve the minutes for the committee meeting.
So moved. So moved.
Second. I have a motion from Senator Spearman and a second from Assemblywoman Considine. Any discussions? Okay, all those in favor, say aye. Aye.
Aye.
Any opposed? Okay, thank you. The motion carries. Okay, agenda item number 4, presentation on the report and recommendations from the Home Care Employment Standards Board of the Department of Health and Human Services concerning the wages and working conditions of home care employees. We will have presenters Mr. Finney, Deputy Administrator, Division of Public and Behavioral Health, Department of Health and Human Services, and Ms. Marlene Lockhart, Government Relations Consultant, the Lockhart Group. Go ahead when you're ready.
Thank you, Madam Chair and Committee. My name is Marlene Lockhart, and I represent SEIU 1107, the largest union of healthcare and public workers in Nevada. Thank you for the opportunity to report on the progress of SB 340 approved last session. I am very pleased to report that the committee is operating as intended. For the first time in the state's history, this legislation has brought together representatives of home care providers, recipients, and employees to discuss and find solutions for the myriad of issues that have contributed to the low wages, poor working conditions, and the chronic shortage of home care workers in Nevada. And you have heard firsthand this morning from some witnesses who have direct experience with these problems. Just about a year ago, the Gwen Center issued an assessment of the personal care workforce in Nevada, reporting that a dire crisis was on the horizon, creating a dangerous home care worker shortage, which will hurt Nevada seniors, people with disabilities, and home care workers alike. To compound an already simmering public policy time bomb, elders count indicates Nevada has been and will continue to experience an aging tsunami. To compound, Nevada's population has increased by 11.42%, while the 65 and older population increased by 40%. Nevada's growth rate for age 85 and older is double the national rate. As you have heard, there are approximately 13,000 personal care aides who assist elderly and physically disabled Nevadans with daily living tasks such as bathing, eating, toileting, and mobility in their client's home. This workforce is disproportionately women of color who are currently paid an average of only $11 an hour with few to no benefits. Close to half of the workforce relies on some form of public assistance because of low wages and inconsistent hours. Home care workers play a critical role in keeping seniors and adults with disabilities out of expensive and less desirable care settings. For example, Nevada saves an average of $70,000 a year for every senior who is served through the frail, elderly, and community-based Waiver program instead of a nursing facility. Despite the important role that home care workers play, which has been all the more evident during the COVID pandemic, the home care industry suffers from a 50% to 100% turnover rate due to the lack of compensation and respect afforded to these women. Lastly, the vast majority of home care in Nevada and nationally is delivered through Medicaid. Most individuals needing care cannot afford to pay out of pocket. As such, the state, through its role of setting reimbursement rates and other Medicaid policies, is responsible for setting unemployment and working conditions for the home care industry at large. And it is absolutely critical. As you will hear, one of the recommendations is to increase the rate reimbursement to providers and to the workers. I want to commend you and the 2021 legislature for having the foresight to enact legislation, SB 340, to immediately address this critical issue. Deputy Administrator Cody Finney has been tasked to chair this Home Care Employment Standards Board, and I would like to thank and commend her for her leadership and professionalism. And now Cody will go through the specific recommendations that have come as a result of the hard work of this board. Thank you, and I'll be available to answer questions.
Good morning, Chair Gorlow and committee members. My name is Cody Finney, and I am a Deputy Administrator at the Division of Public and Behavioral Health, and have had the privilege of being appointed the Chair of the Home Care Employment Standards Board on behalf of the Department of Health and Human Services. I thank you so much for hearing from us today on the board's recommendations for improving home care in Nevada. As part of our investigation, the board has reviewed reports from the Labor Commissioner's Office, Medicaid, and the Bureau of Healthcare Quality and Compliance, which is the entity responsible for licensing home care agencies. The board also conducted an extensive survey of home care workers and employers. The final report and set of recommendations from the board are due to the Director of the Department of Health and Human Services at the end of this year, but several recommendations have already been approved and are in the process of being implemented. I'm going to go through those with a little bit of detail. So the first recommendation that we worked on had to do with agencies covering the cost of training for employees. So due to some excuse me, after all these years, I still get nervous. Due to some ambiguity in the regulations for personal care agencies, many workers reported that they were paying for the state mandated training out of pocket. So the board did pass recommendations to amend some of our regulations to specify that employers, not the workers, are paying for those trainings. That regulation is in the final stage of approval and will require that the administrators of those agencies ensure that those costs of training are covered. The next piece of our recommendations had to do with accountability related to Arpa funding that was made available to improve this service. As part of that Arpa funding initiative, Nevada Medicaid had 2 initiatives to support home care. The first was 2 rounds of $500 checks to home care workers. That totaled about $13 million. The workers had to meet certain criteria, be serving Medicaid patients and also serving during particular time periods. Unfortunately, due to some of the logistics involved with that, the program for workers was voluntary for the employers, and about 25% of the employers did not apply and for that program. And so anyone employed by those agencies was not able to get those $500 payments. The second piece that Nevada Medicaid was working on were supplemental payments to the employer agencies. Those payments were able to be made automatically to the provider agencies based on what they had billed Medicaid for. But this program did not include a lot of policy on how the funds had to be spent. So in response to both of those issues, the board passed recommendations asking Medicaid to first reopen the application period for the first round of $500 checks. Second, send a notice to employers, to the agencies, stating that they were expected to apply for those funds. And third, require the employers to report on how they spent those supplemental payments that went to the agencies. The next important piece of our recommendation involved reimbursement rate and wages. As we've heard this morning, the current reimbursement rate for agencies from Medicaid is $17.56, and the average wage, according to our work, has been is $11, the average wage to the workers. So the board passed a recommendation that Nevada Medicaid include in its budget an enhancement to increase the reimbursement rate for personal care agencies to $25 an hour, and to create a minimum wage of $15 an hour, and require agencies to pay at least $15 an hour to the workers providing the service. Our next focus was on worker education related to their rights as employees. We have referred to this as Know Your Rights, and the board has had a lot of discussion, including with the Labor Commissioner's Office and our employer members who've provided valuable information on this around compliance with existing labor law. It is important that compliance with these laws is critical for those employers who want to follow the rules, but can become an advantage to employers who don't want to follow the rules to break the rules. So it's important that we be able to enforce this as well. Many of the workers testified at board meetings and reported in the board's survey that they do not receive benefits such as paid time off, overtime, and mileage reimbursement, despite the fact that there are laws extending these benefits to employees. The board is finalizing language for a Know Your Rights bulletin that is designed to explain in plain language the current labor laws and policies around home care workers' rights and employers' obligations, including benefits that workers are entitled to, and the importance of not being misclassified as an independent contractor. The process that the board is considering would require that every home care worker receive a copy of the notice and sign an attestation that the agency explained what it means. The notice would be updated regularly to ensure consistency with any changing labor law. In addition, the board has recommended that Nevada Medicaid require personal care agencies that participate in their program to classify home care workers as employees and not as independent contractors. Finally, the board has created a subcommittee on systemic racism to dive deeper into that issue and how that intersects with the home care industry. As you've heard, most of the workers in this industry are women. They are also largely people of color, and there is a lot of intersection here. We've heard some very compelling testimony from both board members and other workers, and some employers and recipients of personal care services regarding this issue. So those recommendations are forthcoming as that subcommittee continues its work. Those are the recommendations that we've finalized so far. I really thank you for allowing me to share about our important work, and we're happy to answer any questions that the committee might have.
Thank you so much for your very informative presentation. Are there any questions from the committee? Assemblywoman Considine.
Thank you for the presentation, and thank you for your work on this committee. I do have a question. You mentioned the first round of $500, but I've heard multiple times that the second round of $500 hasn't gone out. Is there any information or any updates you can provide on that?
Cody Finney for the record. My understanding is that that second round of $500 has not yet gone out, but I would very much appreciate the opportunity to confirm that with our partners at Medicaid and confirm that for you.
Yes, please. I'd like that, or we'd like that information.
Cody Finney for the record. I see Kirsten Kulam is here if you are willing to indulge that.
Good morning, Chair Gorlow. I can proceed if you like, or can follow up with answers.
Yes,
Whatever your
please
preference.
proceed.
Okay, no problem. Good morning, Kirsten Kulam for the record. I'm the Chief of the Long-Term Services and Supports Unit with Nevada Medicaid. And you are correct, we are currently working on issuing a second round of applications for the $500 payment. So for those that might not be familiar, Nevada Medicaid is utilizing American Rescue Plan enhanced funding opportunity through Section 9817. So it's a little bit different than some other American Rescue Plan funding that is available, for example, like through the governor's office. This is specific to home and community-based services. And the enhanced federal matching does allow us to have some initiatives specific to home and community-based services. Back in November, we once we received CMS approval, so we had to submit a spending plan first, receive approval. We worked on applications, had providers apply, and then were able to issue payments in March. And then as Ms. Finney mentioned, we are working closely with the board to receive that feedback on how we can make the next round of payments either a better process for the recipients and just really reaching out to the providers that did not apply. We sent out a survey about 2 weeks ago. We'll be sending it out one more time to solicit feedback on perhaps why the providers did not apply. In Nevada Medicaid, we might have a list of enrolled providers, but that doesn't mean that they're always actively serving Medicaid recipients, or they might not have caregivers available. So we sent out a survey to better understand why perhaps the providers did not apply the first time, so we can take that information and incorporate in that before the second round of payments, and also are looking at making that process a little bit easier. So I hope that helped answer the question.
Thank you very much. I have kind of a follow-up to that. Do we have an anticipated date or timeline when that second round will go out?
Kirsten Kulan for the record. Thank you. I probably should have mentioned that. So I think our supplemental payments unit that works on those reimbursements is concurrently working on our 15% supplemental payment. I think we are anticipating it was August. I think we have some internal challenges with some vacancies, but our goal is to have that done in the next couple of weeks. We are working on updating that application. We had some frequently asked questions that were posted on our website. So behind the scenes, we're trying to get that documentation up on our website ready to go so that when we do send out notices to our partners, that information will be ready, because we did pull the last application down from our website. We didn't want to confuse anyone. I also will just say too, based on the Home Care Employment Standards Board recommendations, we are also, any provider that responds to our survey or that reaches out to us, we are also opening up that first round of $500 payments for those workers. We are working on processing those if providers would like to apply now, because our goal is to make sure that any eligible caregiver that would be able to receive the funds and has that their employer, applies on their behalf, that we can try to get that payment to them. So we are working on also issuing payments for the first round too.
Thank you very much. Are there any other questions from the committee?
Yes, Madam Chair.
Okay, thank you. Please go ahead, Senator Spearman.
Yeah, and I think Kristen answered part of the question, because my question was going to be, how can we use some of the allocated ARPA funds to mitigate this? This goes back to, I think, Cody, you and Ms. Colon were there when I chaired HHS. And we tried for 17, 18, and 19 to try to get these Medicaid reimbursement rates up. And as I remember, it really came down to a matter of funding in terms of revenue stream with the state. So I'm glad to see that we're using ARPA. What I want to do, though, I want to press to see if there are any other adjacent, if you will, agencies that might be doing something where there's another intersection. Cody, I heard you talk about systemic racism and the intersection between mostly women and people of color. Those are the ones that are also being impacted heavily by the affordable housing crisis. And so I didn't hear the folks who, the ladies who spoke at the beginning during public comment say, that was part of the struggle. I did hear one say, it was gas and it was groceries and that sort of thing. But I'm wondering if there are any other resources that we might be able to tap that are co-located, if you will, in this dilemma that will help us maximize those dollars. That's number one.
Thank you, Senator Spearman. Cody Finney, for the record, through Chair Gorlow to you. I appreciate your bringing that up. We have heard from the workers on the board and other workers that housing prices are problematic for them, and that some of them are looking for housing. We have endeavored to bring into the committee meetings some of the information from other agencies, for example, related to the Know Your Rights document, trying to connect some of those folks with other agencies. I'm not aware of a large-scale housing effort at this point that has an intersection here, but we are more than happy to hear, to make those connections and help communicate that information wherever we can.
Yeah, and Madam Chair, if I could just follow up with that, what comes to mind is possibly, and I'm not quite sure if this, crosses boundaries, but NERC may have some information, and some of the other social justice organizations may have some information as to how those intersections have become more prominent for women and people of color. And if we can look at where that bubble is, there a lot of them, just because of size and demographics, are probably down here in Southern Nevada. But if we could take a look at that and then make the case for more dollars from other tangential agencies, am I clear? To make sure that we can maximize that, because I cannot imagine someone who is trying to make it on $11 or $13 an hour. I cannot imagine, the struggles that they are through. So we can take a look at that. And I'm also interested in the systemic racism piece, because we did pass several bills last time that were associated with concurrent resolution 1, I think it was, in the 2020 special session, declaring that racism is a public health crisis in Nevada. And it was Senate Bill 341 that changed the way healthcare delivery is supposed to go to BIPOC communities. So I want to take a look at that, and maybe there's some cross analysis that can be done with Tina Dorch and the Office of Minority Health Services. I'm curious about the enforcement piece. You said we need an enforcement mechanism, and maybe I didn't catch it, but I was trying to hear what the recommendation was, because again, we covered this in 16, 17, and 18, and I believe we did it in 19 in the 19 session. So what is it that we need to be doing differently?
Thank you so much, Senator Spearman. To you, through Chair Gorlow, we have some capabilities for enforcement with healthcare quality and compliance, and so we are working on some of those regulations that I mentioned. We also have a number of these issues that are related to enforcement of labor laws. And we have heard that from the committee members and also other workers in our committee meetings that the labor laws, as we understand them, appear to not be applied evenly across all of this industry. So we are working with the Labor Commissioner's office. Very hopeful that there will be a new labor commissioner appointed soon. And we're working to educate the population about their rights and make sure that these workers who are by nature of the business, perhaps somewhat isolated from other workers because they're working in people's homes, that they have that information on what their rights are, and that they understand and are making informed choices about being an employee versus being an independent contractor, and getting those benefits that are afforded to employees. So again, the board is working closely with the Labor Commissioner's office. We've explored, and I will say the staff has learned a great deal, particularly HCQC staff has learned a great deal about some of these other pieces that are not in Chapter 449 that Healthcare Quality and Compliance enforces, but exist in labor law, and where we can make those connections if we find the possibility that some other body needs to enforce that, we can make those recommendations and referrals and improve the enforcement overall in that way. Does that make sense?
It does, and Madam Chair, with your indulgence, this will be, I think, the last question that I have. So towards that end, in 20, I believe it was 2016, Interim Finance Committee heard a presentation from the Southern Nevada law, and they talked about how seniors were being scammed and how seniors were being mistreated, et cetera, et cetera. So there are probably some seniors in the pool of healthcare workers, home healthcare workers. And I do know that one of the things we did in 2017 was to give enhanced penalties for anyone who did something to someone, and I want to say it was 62, maybe 64 years old. And so that may be another avenue to get people's attention. And if there is any type of communication that you can put up on the website, or maybe a newsletter or something like that, to alert folks who may be indulging in this, perhaps enhanced penalties and what that may be might get their attention, because we're at a critical time right now in terms of people's economic stability and survivability. And it really irks me to no end to know that there are people who are providing a service to folks who really need it and are being taken advantage of by their employer, if you will, or the person who is contracted to do this. So take a look at what the AG's office can do, what the DAG for consumer protection might be able to do, and we may find some remedies there. And if possible, let's look at what we need to do if there is another BDR going forward. Maybe we can look at something that could be done in a BDR that would strengthen that enforcement, and working with the AG's office, make sure that it's airtight. And Madam Chair, that's all that I have to say. Thank you so much.
Thank you, Senator Spearman. Are there any other questions from committee members? No. I do want to take a moment and thank the home health care workers for all that they do. It is an essential position. I know how important it was to my mom when we had a home health care worker taking care of my dad before he passed away. So thank you so much, and we'll continue this conversation. Okay, so seeing there's no more questions, we'll close this item of business and move on to the next agenda item, our work session. Members, you should have the work session documents in your binders. It is also available on the committee's webpage. The work session document contains a list of proposed recommendations related to programs to assist seniors with dementia and their caregivers, supportive services for veterans and military spouses, proposals to assist vulnerable adults, proposal to update guardianship laws, support for telehealth services and applications, and continued efforts to address the homelessness of seniors, veterans, and adults with special needs. Ms. Kalina will walk us through the document. Thank you very much.
Thank you, Chair Gorlow, and good morning, committee members. For the record, I am Ashley Kalina with the Research Division of the Legislative Council Bureau. As nonpartisan staff, I can neither advocate for or against a measure that comes before the forum. With that, I will provide a short overview of the work session. While the work session document is designed to assist the committee in determining what actions it wishes to take, each item in this document may be subject to further discussion, refinement, or action. It is important to remember the committee is limited by statute to 6 legislative measures or bill draft requests, or BDRs, and any recommended legislation proposed by the committee must be approved by a majority of the members. The members may also vote to send as many letters of recommendation or support as they choose and include position statements in the committee's final report. With that, I will now walk the committee through the recommendations in the work session document. The first recommendation before the committee today is to draft a bill to include structured family caregiving as a covered home and community-based service for certain Nevada Medicaid recipients. This program would include a choice for participants to have a spouse or other legally responsible individual as caregivers, a choice for participants of the community settings where they will receive care, a requirement that caregivers must become employed by a personal care agency or intermediary service organization, and receive training stipulated by the Aging and Disability Services Division, Department of Health and Human Services, for participants' personal plan of care, and a daily stipend based on the percentage of the per diem rate paid to the personal care agency or intermediary service organization. Also, as an additional note, other states have designated that percentage of the per diem rate anywhere from 40 to 65%. And in discussions with Chair Gorlow, she recommended that the percentage be set at 65, but that again is open to discussion with the committee members. There are 3 attachments labeled A, A1, and A2 related to this recommendation. Attachment A1 is an example of a similar program enacted in Missouri, and attachments A2 compares the Missouri program against similar programs established in Georgia and South Dakota. This recommendation was proposed by Charles Duarte, the Nevada Public Policy and Advocacy Director of the Alzheimer's Association, and Mr. Barry Gold, the Director of Government Relations with AARP Nevada, based on information and testimony provided during the committee meeting on March 22nd, 2022. Mr. Duarte is participating in person in the legislative building in Carson City, and Ms. Kirsten Colomb with the Division of Healthcare Financing and Policy is participating via Zoom, and they are both available for any questions for the committee, from the committee. Thank you, Chair Gorlow.
Thank you very much, Ms. Kalina. Are there any questions or comments from the committee members? Okay. Oh, Senator Spearman.
I'm sorry. This is just a comment. One of the things that has been proven in research is that hearing loss for seniors is connected in many ways to the advancement of dementia. And so I didn't see in here, maybe I missed it, but I didn't see in here some type, even if we can't cover it, but some type of language that acknowledges we need to make sure that hearing aids in some form through Medicaid are covered for seniors, because I know that dementia is also a form of memory loss. I'm not a doctor. I don't play one on TV, but I think that's true.
Mr. Duarte, are you available to comment on that? We were just having a little discussion that we don't think that quite fits with what our recommendation is, but if you could add any of your thoughts, I'd be appreciated.
Thank you, Madam Chair, and good morning, members of the committee. For the record, my name is Charles Duarte. I am the Public Policy and Advocacy Director for the Nevada Alzheimer's Association, and so it's a pleasure being here, and I much appreciate the fact that you're considering a couple of our proposals for potential bill drafts. With regard to hearing loss, Senator Spearman is exactly correct that there are studies that show that it can exacerbate or advance dementia in individuals who are already experiencing the early stages of dementia, and so it can exacerbate that and quicken it. I don't think that this addresses it directly, whether or not Nevada Medicaid covers that as a medical expense, or even Medicare. I believe Medicare does not cover it. But if Medicaid were to cover it for individuals, that would certainly be a benefit, and certainly something that a physician could recommend to prescribe.
Madam Chair, follow up?
Please, Senator Spearman.
Yeah, I know that I think it was last year that Congress had proposed some changes to Medicare, and it did include hearing aids. So perhaps not directly associated with this bill, but perhaps we might look at some type of resolution urging Congress to go back, revisit that, and pass funding for hearing aids, because dementia is, for our seniors, is a very serious issue, and not only for the seniors, but also for their caregivers and the family members who are living there with them. So if we can't do it with this BDR, then maybe we can consider some type of concurrent resolution for asking our federal delegation to go back and revisit that. Just want to get this on the record.
Thank you, Senator Spearman. I agree. Hearing aids are very expensive and definitely a necessity for our elderly population. But we're going to have a motion to approve. I'm going to request a motion to approve the recommendation for the Medicaid Structured Family Caregiver Waiver.
So
Do I
moved.
have a motion?
So moved.
Senator Spearman. Do I have a second?
Second.
Any discussion? Nope. Okay. Looks like we will write a letter of recommendation to our congressional delegation. As Senator Spearman mentioned, we can do that. So we'll include that in with the Medicaid Structured Family Caregiver Waiver. Do we need to have a second round of motion on that? Yes. Okay, so I will rescind the last motions and ask for a new motion to approve with that letter included.
So move with the amendment.
Thank you. And a second?
Second.
Thank you. Any discussions? No, seeing none. All those in favor, say aye. Aye. Aye.
Aye.
Any opposed? Seeing none, motion is approved. Okay. Motion passed. Ms. Kalina, can you please move forward with the next recommendation?
Thank you, Chair Gorlow. The second recommendation is to draft a bill to require the Department of Health and Human Services, the University of Nevada, Reno School of Medicine, and the University of Nevada, Las Vegas School of Medicine to establish a system of care for the diagnosis and care of Nevadans with dementia called the Nevada Memory Network. In establishing the program, these entities will contract for the services of memory assessment clinics. Clinics would expand capacity by hiring or contracting with neurologists, neuropsychologists, and geriatricians to perform the duties described in the request to diagnose dementia in patients referred by primary care providers, create plans of care, and train primary care providers by screening for and treating dementia. Clinics will use telehealth where appropriate to perform these duties for patients and providers in rural Nevada, and employ or contract with 4 community-based dementia care navigators to perform the duties described in the request to provide care coordination and referrals to community-based services and in-home care, monitor the well-being of care providers, and provide support to care providers, including respite care. More information concerning this recommendation can be found in Attachment B. In addition, proponents of this recommendation included a biennial appropriation of $684,573. On the meeting website and in the committee member binders, you will also find the proposed summary budget. This recommendation was made by Mr. Charles Duarte, Director of Nevada Public Policy and Advocacy for the Alzheimer's Association, and Mr. Barry Gold, Director of Government Relations for AARP Nevada, based on testimony provided in the committee meeting on March 22nd, 2022. Again, Mr. Duarte is available in the Legislative Building in Carson City, and he is here to answer any questions. Thank you.
Thank you, Ms. Kalina. Are there any questions or comments from the committee? Senator Spearman, please go ahead.
Yes, I was just going to say, again, if we can add to that, the quality of life for seniors and for veterans. I've had an opportunity to speak to several veterans who have participated in the Adopt-A-Vet program, and it has been an invaluable service. If we could only expand that, I think we could serve more. And just like hearing loss, for seniors when there are dental problems, they again isolate themselves and it decreases the quality of life. So if there is a way to perhaps add a amendment to encourage our federal delegation to go back and revisit the legislation that didn't pass, I want to say it was 2021, but the legislation that didn't pass because it had hearing aids and it had dental coverage in it.
Senator Spearman, were you talking about the Adopt-A-Vet program that we're coming up to in the agenda? I think you might be ahead of us just a little bit.
I am ahead of my time.
Okay. Are there any other questions or comments from the committee? Okay, seeing none, I'm looking for a motion to approve the recommendation for the, what are we calling this? The Memory Network, yes, thank you. Nevada Memory Network. Do we have a motion?
So
Make a motion. Okay, I think we've got Assemblywoman Considine making the motion as first and second by Vice Chair Spearman. Any discussions? Seeing none, all those in favor, say aye. 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 Any nays? Okay. Motion passes. Ms. Kalina, please move on to the next recommendation.
Madam Chair? With your permission,
Yes.
Charles DeWart, for the record, I just want to say thank you to the committee for the work that you've done on this on behalf of 49,000 Nevadans living with dementia. Thank you.
You're very welcome. Thank you for being with us today. Okay, Ms. Kalina?
The next recommendation is to draft a bill to appropriate state general funds to support the Adopt-A-Vet dental program in the amount of $500,000 for Northern Nevada, with an additional increase of $500,000 for Southern Nevada, for a total of $1 million. Information concerning this recommendation can be found in Attachment C. This recommendation was made by Demetrio Gonzalez, Executive Director of the Adopt-A-Vet dental program, during the committee meeting on April 12, 2022. Mr. Gonzalez is attending the meeting today here in person in Las Vegas, and he is available to answer any questions from the committee at this time. Thank you, Chair Gorlow.
Thank you very much. Are there any questions or comments from the committee? Senator Spearman?
I'm going to try not to be so active. No, I'm not. Yeah, and again, I just want to reiterate the comments that I made before. The Adopt-A-Vet dental program is an essential program here in the state. One of the things that I've asked the folks who are associated with that, if they could look, there is a major provider of implants, and to my knowledge, they are not a part of the Adopt-A-Vet program, but perhaps there is a way that Mr. Gonzalez, you all could take a look and see how we might entice them to become a part of this. As I understand, the payment or the payment for their services is quite expensive. And even if they would just adopt 10 veterans a year at $20,000 a pop, we know that that would be significant. And they can divide it between the North and the South or however you want to do it. But I think there's got to be a way that we can encourage some folks who have national presence with dental, cosmetic dentistry to become a part of this. This is a valuable program.
Mr. Gonzalez, would you like to comment?
Good morning, Chair and committee members. Thank you for having us here. We really appreciate it. Just before I start, to the left of me, I have my Assistant Executive Director and Chief Financial Officer for our program, just in case there's any budgetary questions that are there. But yes, Senator Spearman, we're getting into the partnership. I know I was here to talk about some of the partnerships that we've made here in the South, and that's part of what I'm going to talk about today. If you want me to start with that first, or do you want me to go with how I was going to present it? It's up to you. You just want me to go?
I was going to say it was up to you.
Okay. If you don't mind, Senator Spearman, if I can start from the beginning, then I'll get to your question on some of the partnerships that we've come here. And it's specifically, one of them is going to be to the question that you asked on implants. And we're excited about that as well. So what we have found since we've expanded to the South is obviously the number of veterans are doubled, more than doubled than we have in the North, and the need and the urgency, but also the types of cases that we're seeing. We've been in practice in Nevada for 12 years, and they've done such a great job, but that's 12 years that we weren't here in the South. And because of that, that's 12 years that these veterans that have been here have not been able to see dentists. And because of that, the cases that we're seeing now with 2 in-processings that we've already had have been extreme. The cases that we're seeing now that are coming into the program are just so much more difficult and so much more extreme than the cases that we're seeing in the North, just because we haven't been here and they just haven't been able to see dentists. Also, we've been able to, since we know this problem, we knew before coming to the South that this would be an issue for us, and we needed to think differently about how we were going to approach it. When we initially started in the North, we started with asking local dentists to help us out. The founder, Linda Haig, was the first one to ask her dentist to start, and it just compounded to 142 dentists that we have today from the North to Central Nevada. We knew that the numbers that we have here in the South, that we had to think of it differently. We right now, when we started as of last year, we have 22 dentists already that have volunteered to start taking dental patients for our program. But because of the volume of patients that we have, we knew we needed to act quickly on making different partnerships with different clinics to see if there was a possibility for us to emulate what we're doing at Truckee Meadows Community College, which is housing a dental clinic there with 2 retired dentists and technicians that we pay as well to work there to assist the dentists as well as our staff. And we were able to make those partnerships. One of those partnerships was with Dr. Lydia Wyatt, who's the dental director for the Volunteers in Medicine here. And she has offered up her clinic to do the same thing that we do in the North with TMCC. And that's just been so exciting. The ability to go ahead and start that right now with what we have and start getting retired dentists to come and participate in our program. This is going to put us ahead of the game. When we first started using TMCC, we were in what year? I think we were in our 9th year. Yes. We were in our 9th year in practice as a dental program, and now we're going into our 2nd year, and we're excited to see that can be a possibility. Working with Dr. Lydia Wyatt as a director, she has offered a space for us. She has offered the dental clinic for us. The only items that we would need to procure are obviously the dental equipment that we would need, which would be hand pieces, consumables, things that we use normally at a dental clinic. Obviously, they have their own material that they use, and we can't, take that from theirs because they're also a nonprofit. The other partnership that we made was with Dr. Thacker from Roseman University Dental School. So they have a dental school here in Nevada. It's a Utah-based dental school, but they do have a charter here. And he's a Navy dentist. He just got out, but he's offered his services to partner up with us as well to see veterans and also do more sophisticated, more advanced type dentistry for our more severe dental veterans that we have. But it's a great partnership being with the university that we're able to use them with minimal cost. Their students are the ones that need the type of cases that we have. And so we would need to pay for the labs just as we do always. And we will still need to make sure that the patients meet all the requirements for their medical side of things before they get treated there. The third partnership that we made was with Christian Medical and Dental Associations throughout the United States. So they do have a charter here, and they do have dentists. And I met with them last week, and we're trying to put together a process where all those dentists can start seeing patients as well. Aside from that, we knew that Vegas is so huge. It's just so much larger than Reno is, and there's no way that we could have put an office like we have in Reno in one central location and expect patients to go there and meet us for in-processing. So what we've done is we've partnered up with 8 Calvary chapels throughout the Southern Nevada and also a couple of Baptist churches. And what they're offering us is their business centers to do our in-processing all through Nevada and the surrounding areas of Nevada. How does that help us out? It lowers our costs. We don't have to have an office that is so large that we can bring all these people in. I can just go from location to location, and however close those veterans are from those churches, we can bring them in there, do the in-processing. We don't have to rent a space to do that. So we've been able to lower costs with that. Now, we do eventually want to get some type of office here, but coming here last year at the end of COVID was really not the time to do that. So I live here in Vegas. My office is in my home, and so I'm kind of running it out of my office out of my home right now, which is fine. But eventually, we do want to have an office where we can have a central location. But for the time being, because we're so new, we wanted to minimize the cost because we have not increased our budget and our cost from the north. Everything we did last year was just trying to cut every cost we possibly could to make up the difference for us being in the south. The other area that we partnered up with is LV Reach. So LV Reach is an organization that gives education services and also medical services to low-income veterans and civilian sector personnel, just individuals in the city of Las Vegas and surrounding areas. And so we're able to partner up with them, use their facility, and also our veterans are able to get education services from that area. We know when you go into the military, you get technical expertise that they can use on the outside. Dental is not the only thing that we do here. We do so much more than that. We try and get them to the point where they can start going out to the community, face the community, and not be embarrassed about what their teeth look like. And so adding that education part to it, getting them off being homeless, partnering up with HUD-VASH and getting them into processes that get them involved and excited to live again rather than just hermiting and being in their homes and not coming out because they're so embarrassed to not get seen with what they look like. But LV Reach is we've partnered up with them twice already since I've been here in July, and it was very successful. They were able to get in contact with different services that they can use to get them out in the community and start work, which is the ultimate goal, is to get them out in the community and start working and get off of homelessness. And the other, so Dr. Blasco, now Dr. Blasco is well known in the community here. He's the dentist for the Knights and for many sports teams here, but he is also one of the prominent implant dentists here in the state of Nevada. He was also the president of the Southern Nevada Board of Dentistry here as well, and he holds many offices throughout for the dental community. But he has partnered up with us. I spoke with him yesterday. He's excited to come on board. His whole practice is built around implants. And what Dr. Blasco also does is he does training and continuing education courses for dentists around the state of Nevada, and that can only help our program out more. We are limited on the amount of implants that we do, and as you said, Senator Spearman, because of the cost. But now that we're partnering up with Dr. Blasco, this is a great opportunity for us to cut that cost. I don't ever think that it will be a point where it won't cost something, but the ability to cut down the cost is just, it's a promise somewhere. It's something that we can look forward to. So, but that's the partnerships that we've made so far. We have been able to do that, but with that partnership, the ability to have all those partners, there's so many dentists that we can't approach because the cost is too great. So with the 22 dentists that we have now, with the budget that we have now, with just what we receive for the North, we can't really reach out to any more dentists because we just couldn't afford it. We pay for all the dental laboratory costs that are associated with the dental care. So while the dentist may see the patient pro bono and pay for all the services that way, one of the biggest reasons why they like partnering with us is we do all the administrative work. They don't add that. Whenever they take a patient, they don't add that administrative work to their staff. We have staff members that do that. They from the time they come into the program, any type of medical issues that need to be mitigated prior to being seen, our staff members go with that individual. They process that individual all the way through until they start their treatment, and throughout the treatment until the end of treatment. And so that's why they like working with us. The other reason is because we pay for the laboratory cost, which the laboratory costs are pretty significant. Bridges, crowns, all these different types of dentures that we have to do, RPDs, replaceable partial dentures. You get enough of those going and the cost becomes excessive, and it's hard to keep up. We do yearly fundraisers, we do monthly fundraisers, and it depletes quickly because of the cost of these associated costs. And so, but as far as the implants are concerned, we're excited. We don't know what that looks like yet. Dr. Blasco and I are still in conversations on that, but hopefully we'll get those going.
Thank you very much. Any other questions or comments? No? Okay. Seeing none, I ask for a motion to approve the recommendation.
So moved.
So moved.
I think Assemblywoman Considine got the motion. Senator Spearman, did you want a second?
Yes, I do. Thank you.
Okay. Any discussion on the motion? Seeing none. All those in favor say aye. Aye.
Aye.
Any opposed? Say nay. Motion passes. All right. Thank you very much.
Thank you.
Okay. Ms. Kalina, please move on to the next recommendation.
The fourth recommendation in the work session document is to send a letter to Nevada's Department of Education expressing the committee's desire for the Nevada Department of Education to work with the Heroes to Education program to assist service members, veterans, and military spouses transition into careers in public education. The program is intended to be a public-private partnership to help fill K-12 positions, including education support staff, security, and/or resource specialist. This letter would also encourage the creation of a state coordinator position to oversee and manage the program, and 2 facilitators or recruiters within the department to collaborate with nonprofit organizations and local, state, and federal agencies to better connect veterans to available K-12 employment opportunities throughout Nevada. This recommendation was proposed by Assemblywoman Michelle Gorlow, Chair of the Legislative Committee on Senior Citizens, Veterans, and Adults with Special Needs, in consultation with LCB staff and additional communication with Dr. Georgianne Rice, representative of the Heroes to Education program in Nevada, in response to testimony provided during the committee meeting on April 12, 2022. Dr. Rice is participating in the meeting via Zoom and is available to answer committee questions. Thank you, Chair Gorlow.
Thank you. Any questions or comments regarding this recommendation? Senator Spearman?
Just trying not to say anything. This is just a comment, and they may already be doing it. But one of the things we might be able to look at is working with DOD, or specifically Nellis, to see if they have any incoming service members who might fit the qualifications for the Heroes to Education work. I know when I was overseas, I used to get a lot of mail once I was getting ready to come back home, get a lot of mail about different opportunities and things of that nature. So that might be some place where we might be able to get additional information upfront so that we could prepare for that. The next thing would be working with probably the Blue Star moms. And those are folks who have family members who are deployed overseas. Some of them may fit the qualifications for that, or their loved one who's overseas might do that. We could also check with our National Guards, Army and Air Force to see if there's anybody in the Guard that's not full-time, see if they fit some of those bills. So those are some of the ways that we might be able to expand the program in relatively minimum amount of additional staffing.
Dr. Rice, would you like to address those comments?
Yes, Madam Chair, and thank you, Vice Chair Spearman. We already are working with the Nevada National Guard, also the Reserve, also the Department of Veterans Services, and they get a list from the Department of Labor every single month of the people who are leaving the service who have indicated that they're moving to Nevada. And they have agreed to put within that packet information about jobs in public education that are available in the areas to which they're moving. We also have talked to the Airmen and Family Readiness Center at Nellis. Also, we're involving even community groups. For example, like the Las Vegas Chamber of Commerce Military Affairs Committee. So anyone who has connection with the military that we've been able to think of, we have involved them and their commitment to work with us in trying to staff the schools of the 17 school districts plus the public charters.
Thank you.
Thank you very much, Dr. Rice. Senator Spearman, did you have any other questions or comments?
No additional comments. She covered it all.
Right. Thank you. Anyone else? Nope, seeing none. I will accept a motion to approve the recommendation.
So moved.
I have Vice Chair Spearman. Second?
Second.
Assemblywoman Considine. Any discussions on the motion? Seeing none. All those in favor say aye. 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 Okay. Any opposed say nay. Okay. Motion carries. Ms. Clamp, we'll move on to the next recommendation.
Recommendation 5 on the work session document contains 2 recommendations that are independent from one another but are proposed together so that if the members decide to move forward with both, then they would be included into one single BDR. Recommendation 5A is to draft a bill to create a vulnerable adult protection order under Chapter 33 of NRS to protect vulnerable adults against abuse, neglect, or exploitation. This would be a redraft of the Assembly Bill 407, which was a failed measure from the 2021 legislative session, with proposed amendments which can be found on attachment D2. And/or recommendation 5B is to establish an independent authority for adult protective services to apply for access warrants in cases of suspected abuse and/or neglect of vulnerable adults. The execution of the access warrant would include a partnership effort with law enforcement and/or a peace officer, probable cause standard, and additional language to instruct the person in control of the premises and provide them from barring access or interfering with the investigation. These provisions would ensure APS can meet independently with the adult suspected of being abused and/or neglected without coercion or undue influence. More information concerning Recommendation 5B is available in Attachment D and D1, which contains statutory examples from Arizona, Mississippi, and Missouri. Both of these recommendations were made by Jennifer Richards, the Chief Rights Attorney with Aging and Disability Services Division, in response to testimony provided during the committee meeting on June 28, 2022. She is attending the meeting in person in Carson City and available to answer any questions. She can also give further explanation on how this is different from Assembly Bill 407 from 2021 and what the proposed amendments are. Thank you, Chair Gorlow.
Thank you. Ms. Richards, would you like to come to the table and provide some comments?
Good morning, Madam Chair and members of the committee. Jennifer Richards, Chief Rights Attorney, Aging Disability Services Division, for the record. Thank you for the opportunity to be in front of this committee again. I'll be brief. We did a comprehensive presentation to this committee previously. The protection order is substantively the same. We incorporated the recommendations from the Public Defender's Office that we received last session. I also took the liberty of adding in some language from Florida's exploitation injunction order. And you can view that on, oh, the pages aren't marked in the work session. It's highlighted and italicized, and it addresses financial institutions freezing assets in joint accounts. When I talked to our national experts on protection orders and our partners at Legal Services in Florida, they felt that this was a very important addition to their statute in order to address financial exploitation in their state. So I went ahead and added that language. Otherwise, the protection order is substantively the same as it was in 2021 with those additions. Regarding the access warrant, that is a new proposal this session. And as we presented to the committee, we're trying to address adult maltreatment across the system. And so we're looking at preventative measures through the protection order and in improving outcomes at the investigation stage of the case as well. And so the access warrant will allow us to intervene earlier and assess the situation of these adults. When it's bad, it's been very bad for some of the cases that we've had. And individuals are coming out on a stretcher, or they're not coming out of the situation. So I don't want to belabor the topics. I'd like to answer any questions that the committee may have on either of these initiatives.
Thank you very much, Ms. Richards. Committee, do you have any questions or comments?
Madam Chair, just have a question, and I just want to make sure this is
Please go ahead.
I'm sorry, enhanced penalties. Enhanced penalties.
Ms. Richards, do you want to comment on that?
Jennifer Richards, Chief Rights Attorney, Aging Disability Services Division. Through you, Madam Chair, to Senator Spearman, I heard the question of, are there enhanced penalties for violation of the protection order? Is that correct?
Yes, ma'am, throughout the whole bill, just enhanced penalties so that wherever the people who are perpetrating this type of insidious act on seniors, to make sure that we get their attention.
Jennifer Richards, Chief Rights Attorney. Thank you for the clarification, Senator. Yes, there is in the proposed bill a tiered penalty for violation of the protection order itself. There already exists in state law an enhancement for crimes against a vulnerable adult under NRS 200.
Thank you, Madam Chair.
Thank you. Are there any additional questions or comments? Seeing none, I will accept a motion to approve the recommendation.
So moved.
I have a motion by Senator Spearman.
Second.
Assemblywoman Considine. All those in favor, please say aye.
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 Any opposition, say nay. Motion carries. All right, thank you very much. And Ms. Kleena, we'll move on to the next recommendation.
The next recommendation, recommendation 6 at the top of page 4 of the work session document, is to draft a bill to establish a baseline of eviction protections for all individuals in residential facilities for group residents that mirrors federal regulations, complies with the requirements of the settings rule, incorporates a notification process to alert the long-term care ombudsman program of the Aging and Disability Services Division within 30 days of a proposed eviction, provides for penalties for facilities that do not follow the process with enforcement mechanisms, and designates a forum to adjudicate eviction disputes. According to ADSD, the Department of Administration is the current forum for skilled nursing appeal hearings. Federal regulations provide a method and guidance for appeals officers to follow. Proponents of this recommendation note that Illinois compiled statutes should be considered, especially the essential contract requirements, which would mirror Nevada's existing landlord-tenant law under Chapter 118A of NRS. Information concerning provisions enacted in Illinois are located on page 60 of the PDF in attachment E1. This recommendation was proposed by Marie Coe, interim state long-term care ombudsman with ADSD, in response to testimony provided during the committee meeting on June 28, 2022. She is attending the meeting in Carson City in case members have questions about this recommendation. Thank you, Chair Gorlow.
Thank you, Ms. Kalina. Are there any questions or comments from the committee? Okay, seeing none, I'll accept a motion to approve the recommendation.
So moved.
Vice Chair Spearman, second.
Second.
Assemblywoman Considine. Any discussion on the motion? Okay, seeing none, all those in favor say aye. 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 Any opposed, say nay. Motion carries. All right, Ms. Kleena, moving along to the next recommendation, please. Thank you.
The next recommendation is to draft a bill to amend provisions of Chapter 159 of NRS to make the statute more consistent with the Protected Persons Bill of Rights, which is geared toward preserving as much autonomy and independence as possible for protected persons given their unique circumstances. More specifically, the amendments would require petitions for temporary guardianship to identify the specific risk that warrants the temporary guardianship, and the court should limit the scope of the temporary guardianship to address specific unidentified need, and clarify that the protected person has the right to decide who to visit and communicate with, and this includes the right to decide who they do not wish to communicate and visit. Allow protected persons to appeal court orders that have significant life-changing impacts on the protected person's life, such as an order restricting the protected person's ability to communicate with a friend or family member, or when the court grants the guardian permission to move the protected person out of state. To terminate a guardianship if a protected person presents sufficient evidence showing the guardianship is no longer needed, and the burden shifts to the party opposing termination to show why the guardianship should not be terminated. to require the court to make written findings on each of the reasonableness factors when attorneys seek fees from a protected person's estate, to remove the award of attorney's fees when the notice of intent to seek fees from the protected person's estate is not timely filed, to prohibit attorneys from seeking fees under who fail to seek fees through the process outlined in NRS 159.183 to NRS 159.344, to reimburse an attorney as a guardian ad litem and not as an attorney at attorney rates if a court appoints an attorney to act as a guardian ad litem, to include the petitioner and the proposed guardian's phone and email information in the petition for appointment of a guardian and have the needs assessment attached to the petition, and require written findings in the order granting guardianship that less restrictive alternatives are not available to meet the needs of the proposed protected person. Information concerning this recommendation can be found in Attachment F. This recommendation was proposed by Deborah Bookout with Legal Aid Center of Southern Nevada and Jonathan Norman with Nevada Coalition of Legal Service Providers in response to testimony provided during the committee meeting on June 28, 2022. Deborah Bookout is attending the meeting here in Las Vegas and available to answer any questions from the committee. Thank you, Chair Gorlow.
Thank you, Ms. Kalina. Are there any questions or comments from the committee? Okay, seeing none, I will accept a motion to approve the recommendation.
So moved.
Vice Chair Spearman, and a second. Second. Assemblywoman Considine. Any discussions? Okay, seeing none, all those in favor say aye. Aye.
Aye.
Any opposed, say nay. Motion's approved. Thank you very much. And with that, we'll move on to the next recommendation.
The next recommendation at the bottom of page 5 on the work session document is to send a letter to the Division of Healthcare Financing and Policy of the Department of Health and Human Services to seek approval from the Centers for Medicare and Medicaid Services, expressing the importance of offering telehealth options for seniors, veterans, and adults with special needs in Nevada, particularly in rural communities, to allow Nevada Medicaid to finance Project ECHO applications for telehealth providers and services in Nevada. Information concerning Project ECHO is available in Attachment G and Attachment G1. This recommendation was developed by Chair Gorlow in consultation with LCB staff and additional communications with Dr. John Packham, co-director of Nevada Health Workforce Research Center at the University of Nevada, Reno School of Medicine, in response to testimony provided during the meeting on June 28, 2022. Dr. Packham is available via Zoom, along with Dr. Gerald Ackerman, Troy Jorgensen, and Dr. Mordecai Lavie for any questions from the committee. Thank you, Chair Gorlow.
Thank you, Ms. Kalina. Do we have any questions or comments from the committee? Okay. Seeing none, I will take a motion to approve the recommendation.
So moved.
Vice Chair Spearman, and second? Second. Assemblywoman Considine. Any discussions? All those in favor say aye. Aye. Any
Aye.
opposed say nay. Okay, motion carries. Thank you very much. And I believe this is our last recommendation. Okay.
The final recommendation of the work session document is to send a letter to the governor and the Division of Public and Behavioral Health of the Department of Health and Human Services, expressing the committee's support of the Nevada Interagency Advisory Council on Homelessness to Housing, emphasizing the increasing need for greater coordination of state agencies and consolidated efforts to address the growing need for safe and healthy housing and wraparound services for Nevada seniors, veterans, and adults with special needs. Information concerning Nevada's homelessness is included in attachments H, H1, H2, and H3. This recommendation was developed by Chair Gorlow in consultation with LCB staff and additional communication with Ms. Shanika Cooper, manager of the Homeless to Housing Program. Social Services Manager of the Division of Welfare and Supportive Services of DHHS. Ms. Cooper and Ms. Kelly Cantrell are attending it, and they are available to answer any questions related to the Interagency Council on Homelessness to Housing. Thank you, Chair Gorlow.
Thank you, Ms. Kalina. Are there any questions or comments from the committee? Senator Spearman.
You're
Please, go
reliable,
ahead.
Vice Chair. Reliable to ask questions or make comments. I just want to include in the record a 72-year-old called me a few weeks ago, a couple of months ago actually, and in tears that her Social Security income was only $1,600, and her rent that was $900 for several years. She just received a letter from her landlord that the rent was going up $1,400. And I think this is a very timely recommendation. I guess what I'd want to know, is there anything that we can do between now and the first Monday in February when the legislature reconvenes to make sure that our seniors are not pushed out because of increased rates. And when I talked to the lady, there had been no improvements made in the property. There had been no paint, no painting, no carpet refurbishing, nothing. The only thing was just that the rent was going up. So I don't know what can be done in terms of, the working with the interagency folks, but certainly we need some relief for them right now. Thank you.
Thank you very much. Would you like to comment on that?
Shanika Cooper, the manager for homeless to housing under the Division of Welfare and Supportive Services. That exact question has been raised by not only the council, but our 3 COCs for the northern, rural, and southern. That is also continuously being worked on and updated in the Nevada State Strategic Plan for homelessness. So that is a topic and is an issue that is being worked on as we speak.
Thank you.
Thank you. Any other questions or comments for Ms. Cooper? Okay, seeing none, I will accept a motion to approve the recommendation.
So moved.
Vice Chair Spearman, and a second? Second. By Assemblywoman Considine. Any discussions on the motion? Seeing none, all those in favor say aye.
Aye.
Any opposed, say nay. Okay, motion is approved. Thank you very much, and thank you so much for being here, Ms. Cooper. Okay, and with that, we will now move on to public comment. We will start with public comment from those in the physical locations and then move to public comment for anyone who is called in. Please remember to clearly state and spell your name and for the record, and limit your comments to 3 minutes. Staff will be timing each speaker during public comment to ensure everyone is given a fair opportunity to speak. So we'll start in Carson City. Is there anyone who would like to provide public comment at this time? Okay. I'm not seeing anyone come up to the desk. So is there anyone in Las Vegas who would like to provide public comment at this time? Please come forward. And either chair is fine. And the button's right up to the front. Thank you.
Hello, my name is Shanika Cooper. I am a home care worker here in Las Vegas, Nevada. I am also a member of the Healthcare Standards Board and the Systemic Racism Committee. I'm here today because I am a worker that is displaced. I recently reached out to Ms. Pat Spearman and some of the other colleagues that I know. I am struggling. As you guys may know, the cost of living has gone up here. And as a home care worker that does take care of my disabled son, I don't make enough money. We are asking for $15 an hour, but even at $15 an hour, it's not enough. I don't know what else to do. Aside from myself, we do care for elderly people that we are the only people that they see. They don't have family, and it's a scary thing. As for me, myself, is scary. I can only imagine how they feel to not have anybody to call on or to go to. And I just want to ask for, there has to be something that has to be done. In my situation, the owner does not live here. He lives he lives somewhere else. He doesn't live in the state. He raised the rent, and instead of him just saying, hey, I'll give you time, they wanted us out in 3 days. What do you do in 3 days? It's a crisis, and it's a scary thing, and I'm just here in support of others and myself to try to see what we can do to get help here in the state. It's gone up. They ask for 3 times the rent, and we don't make the rent. And so I'm just asking for some kind of help from the state to help people like myself and elderly people. I can't get sick because if I don't work, I don't make money. And with that being said, I just want to thank you guys and everyone on the board for trying to do something to help people like myself and elderly people in the state. But I am hopeful that something is going to be done, and I just want to say that it's a great state of Nevada, but it's kind of scary situation right now with the housing crisis and, the things that are going on here. So thank you.
Thank you, Ms. Cooper, for sharing your story and being here today. We do appreciate you very much. Not seeing anyone else in Las Vegas who would like to provide public comment at this time. A BPS staff, is there anyone on the telephone who would like to provide public comment?
Thank you so much, Chair. To provide public comment, please press *9 on your phone now to take your place in the queue. Chair, the public line. Just one moment. We just had a hand raised. Just one moment. Caller, you're unmuted. Please proceed.
Good morning. Hi. Good morning. This is Dora Martinez, the Nevada Disability Peer Action Coalition activist. I just want to agree with the brave and courageous young lady that made a public comment. Please, I hope it's possible, instead of $15 or $17 for the PCA, to make it $25. I trained disabled people and people who are elderly, who are hard of hearing or visually impaired. I go to their home and I teach them, how to use their iPhone or Android tablet, PC. And while I was there, her PCA came in and was hungry. She didn't have enough money to get groceries. So, my client offered her food. And I know, and she barely has enough. And I think that that's a really impactful story, that $15 an hour or even $17 is not livable. I mean, you go buy milk and my kids tell me it's like $5 and gas is expensive. Luckily, I don't drive. I use the public transportation, and even that is sparse in here in Reno, Nevada. And my coalition is I'm jumping to another topic because I know I'm limited. And my coalition, we're trying for the RTC here, Washoe, to subsidize a bus fare for people, because $3 per ticket for paratransit riders, it's just simply hard for people that goes to dialysis. They got to choose if they're going to pay for groceries or go to doctor's office. So we're trying to work to see if RTC can subsidize that. And I'm sorry, I'm jumping around. I just know that I'm timed, and I know you guys are probably hungry. But thank you so much for all that you do. You guys are the best, and thank you for listening to us. Take care, drive safe, drink lots of water.
Thank you very much, Ms. Martinez, for joining us again. Is the BPS,
Chair,
is there
the
anybody
public
else
line
that's
is
on the
open and
telephone?
working. However, there are no additional public comment callers at this time.
Okay, thank you very much. That will lead us to the end of our meeting. Committee, do you have any questions or comments before we adjourn?
Madam Chair?
No. Please, Vice Chair Spearman.
Yeah, I was just going to say, I just want to take this time to thank you for your leadership during some rather tumultuous times and the timely recommendations that you and the members of the committee have come up with for those persons that we are tasked with assisting. So thank you for that, to Chair, to the members, and to our staff who've done a yeoman's job, especially in making sure that those of us who had to participate remotely were able to do so. And want to also thank the community for their comments, because I think it's the public comments that help make us better and more precise in the work that we do for those who elected us and for whom we have this sacred trust. So thank you.
Thank you, Vice Chair Spearman, and you kind of beat me to it. I also would like to thank everybody who has made this interim committee really special and productive, and all the commitments and contributions everyone has made, from our committee members, staff. Thank you, thank you, thank you. I could not have done it without them. They have been absolutely, truly amazing. All of our presenters who spent time researching and coming to us with their recommendations and explaining the issues that are so important to Nevadans. And of course, BPS, that makes sure that all of this is being able to be out into the public, video, been able to have our Zooms and people calling in rather than having to testify in person. So thank you, everyone, for all your support during this interim committee. And with that, if there's no other comments or questions, I will adjourn. Thank you.
Thank you. Have a great weekend.